opposition to any items on the agenda, then the agenda is adopted by unanimous consent. We're going to go through some reports. We've got one main report on graduation rates, and then after that, we will get to the mask report, and then a little bit more business, and then the mask vote. Just setting that expectation with the agenda. Okay, so first, we've got our report on budget amendments for July 2021 through December 2021. I turn to the superintendent for this report.
As presented, Madam Chair.
Okay, and now we've got the report on capital project ordinances for July through December 2021. I turn to you for this report.
As presented.
Okay, and now we are going to move on to our monthly student outcomes, our monthly progress monitoring report. Tonight, we're going to be looking at the four-year cohort graduation rate, which is available on our board docs if anybody wants to pull it up there, and I believe a link will be shared on social media. And as a reminder to my board members, I know many of you sent in questions in advance, the technical sort of clarification questions, and we got responses to that via email. So tonight is really for strategic conversation about the graduation rate. And so before we dive in, just a quick check off. Do we believe that the report matches, does reality match? Okay, wait. So there are fundamental concerns of monitoring. 1, does reality match the vision? 2, is there growth toward the vision? And 3, is there a strategy and plan sufficient to cause growth toward the vision? If the answer to all 3 is yes, then the board can accept the monitoring report, confident that the superintendent is reporting. So do we want to go ahead and go on with this?
Yes.
Yes.
I agree, yes.
All right. So, and just a reminder, we're not offering advice in this. We're just asking strategic questions. Who would like to ask? If you'd like, we could start with what questions. Things such as, or who questions. Do you have any who questions or what questions? Like which students are the data talking about? What questions are, what circumstances surrounding the data regarding struggling or excelling students? You want to start with one of those, Ms. Shipp?
One of my what questions are, what are we doing more specifically with the 9th graders early intervention to support increase in the four-year graduation cohort?
Thank you for that question, Ms. Shipp. So as was provided in the progress monitoring report to the board previously, we have a sort of a two-pronged strategy. One part of that strategy really looks at our 12th graders, our current seniors. But the other part of that strategy really looks at those students who are in 9th, 10th, and 11th grade. And so there are a number of things that we do specifically related to our students in our earlier grades. That includes progress monitoring our students, certainly looking at our early warning indicators to make sure that students are on track. And so we're monitoring absenteeism, we're monitoring suspensions, which include any behavioral issues, and we're also monitoring grades. So how are they doing in their courses? We're monitoring all of those things. And, I will share with you one of the strategies that we want to become more adept at is really systematizing some of the approaches that we take. Some schools do it really well, but we want to make sure that that happens across the entire system and not just in pockets.
And that was what I was looking at too. across the entire district, and how early are we focusing on not just the 10th and 11th, but also as they come into ninth grade?
Yeah, because we know that, the challenges begin way before students get to 12th grade. Those challenges occur in the earlier grades. And so more monitoring at the earlier grade levels, and then responding with real-time interventions to help address those challenges that students may be facing.
Thank you.
Does anybody else have a who or a what question? Juan?
So this is supposed to be, well, anyone who reads the document is going to be able to know the actual, like, what your goal is, but I wanted you to please explain to everyone else who has not had the opportunity to share, like, to see the document because of X or Y reason, like, what are the actual goals of this program and what is being shown by this report, especially, like, I know many students are not going to go over the document because it's really long and they may not understand all these words. So could you explain it to them, like, what are your plans?
Sure. So this progress monitoring report, as Madam Chair mentioned, it's something that we discuss on a monthly basis at our school board meetings. This particular report is around our 4-year cohort graduation rate. And so the first thing that you will encounter on the report is what exactly are we monitoring? And that is the percent of students who graduate with their 9th grade cohort in 4 years. And so one of the goals of our current strategic plan says that we will increase from 89% in 2017 to 95% by October of 2024. And so that is the goal. What you'll see on page 2 of the progress monitoring report at the very top is that we are currently off track to meet that goal. And so you'll be able to see what are our actual targets and where are we currently in the first graph. The second graph, or the first table, shows the percent of students who graduated in 4 years or less with their 9th grade cohort. And so we wanted to make sure that we lift that up by, demographic groups, and, including, our English learner students. And then as you move on, and I won't go through the entire report, but as we move on, we talk about some social and emotional items in the report, as well as our dropout rate. And then we provide the strategy that we're employing and executing on for our 12th graders, as well as those students in the earlier high school grades.
Thank you.
Thanks for that grounding question. Ms. De La Hara?
This is more of a who question. I'm referring to table 1 that's listed on page 2. I noticed that you don't have, or we don't have, targets for English learners or those with 2 or more races. Why is that?
Ms. De La Hara, I don't believe that data is available. I will double check to confirm, but I don't believe that data is available.
Okay. Thank you, that would be great.
Ms. Marshall?
Thank you. I'm going to take us down to I believe it's page 3, that talks about our social emotional skills and connections. And my question is, the panorama data on page 3 shows low levels of student engagement. Was this lower during the last 2 years? And what are the strategies to improve that engagement?
Yes, one of the things that we did experience, Ms. Marshall, being in a hybrid and remote learning environment, is that we saw the level of absenteeism and the level of engagement not quite what we typically expect and see from our students. And so, really making sure that we form better connections with our students, and so we deepen those supports from our counselors, our social workers, and our psychologists, deepening those relationships between home and family. You know, we do have a team in Charlotte-Mecklenburg schools called our street team, part of our student services team, and they go out and they try to re-engage families. They're knocking on doors to try to find out exactly why students are not as engaged as they typically have been under more normal circumstances. I know that word normal gets overused, particularly in a time like this, but those are some of the steps that we have taken, and I think what you'll see in future budget asks is a recommendation to increase those levels of support so we can deepen that particular strategy.
Okay.
Did I see you, Ms.
No,
Ship?
no, no, I think it's over there.
Oh, Juan?
Following up on what Ms. Marshall said, do we have information on what are those things that are keeping students from going to school, like participating in class, being absent and out of school?
Yes, and so it really varies from student to student. We cannot say that what impacts one student necessarily is the same, are the same issues that are keeping, you know, another student out of school. And so we know that, you know, one of the factors is that, you know, students who come in and, you know, education is a priority, but it may not be as high of a priority for some students because they have real family matters that they have to address, and that may include working or taking care of siblings. And so that may impact attendance, it may impact absenteeism, and that directly correlates with how well students do in school. So those are some of the reasons why we don't see as deep a level of engagement with some students versus other students.
Ms. Sawyer?
If it's okay to move on to a more future-facing question?
I
or do
got
you
a
wanna
couple.
hold
Do
on?
we have any more past-looking questions? I've got one or two before we move on. So, talking about graph 1 on page 2, where it just starkly shows that we're not on track to, you know, to along with our strategic plan 2024 goals as far as our graduation rate. So is there a particular strategic misalignment that attributes to that? Like, is there a strategy that was not implemented with fidelity, or is there a strategy that needs to be adjusted to match reality? Or is there a strategy that's just missing?
So as I look, Madam Chair, at the percent of students who have graduated or are on track to graduate in 4 years or less with their 9th grade cohort, one of the things that, you know, I would lift up is that, you know, our business rules changed in 2017, 2018. And so when we released our targets, we actually, we used 16, 17 data for that baseline point.
So
And-
right after we determined the targets,
Exactly.
that all changed, okay.
It all changed, and so some people may look at the data and say, well, you know, we are behind. And I would say that it's less that, it's not as much that we fell behind, but that after the business rules changed, we actually never recovered from that change of the business rules.
But regardless, we need to do better.
We absolutely need to do better. We absolutely need to do better. And so part of our strategy is lifted up in the latter part of the document that we shared with board members. And there are some short-term steps that really impact the 12th grade students, so students in their senior year. But our greatest room, our greatest opportunity for growth is really impacting our students at the 9th, 10th, and 11th grade level. So we absolutely need to do better.
So do you want to transition to some future-looking questions, Ms. Sawyer?
Sure. The report says that a disproportionate percentage of students who drop out annually, approximately 40 to 45%, are Hispanic. If we do not stem dropouts, we cannot meet future four-year cohort graduation rate targets. In response to some of the questions we sent in advance, in response to question 5, you said, CMS and our partners have been ineffective in reducing absenteeism. And my question is, if we can't fix absenteeism, what strategy do we need to adopt to increase graduation rates among Hispanic Latino students? So if we can't fix the absenteeism, what can we control? What are our strategies?
So thank you for the question, Ms. Sawyer. We have not been as successful as we want at this particular point, but I have not, and the team has not given up to imply that we will never be able to fix it. We are working with our partners at communities and schools to help address the issue around absenteeism and to help re-engage our students. So that is something that we are continually working on. But I will share with you that we do have high concentrations of our English learner students who their school experience does not necessarily align with their immediate priorities. And so that is a challenge. And what we hear on the ground is that there is some concern about who may be advising some of the advice that our students receive. They may have completed high school in their home country, but when they enroll in CMS, they enroll in our high schools, and there are challenges. And so that's something that we grapple with and that we do have to solve for. But to the extent that we can strengthen our partnerships with partners such as communities and schools, and then also deepen the supports of all of our students, then I think we will begin to see progress in that area.
But the report said communities and schools has not been successful in stemming the absenteeism. So doing more of communities and schools, how will that fix absenteeism?
Well, so yes, we have not, and we work together with them, so I don't want to put this completely in the lap of communities and schools, but we will obviously have to look at some of the deeper strategies. And when I think about, if you look at on page 2 in that first table, I think particularly when you look at the English learner students, we actually saw an increase in the percent of students who actually graduated in 4 years. And so there are some specific strategies that we've actually employed to actually see those numbers. Some of those strategies include providing additional tutoring and mentors through partnerships with the Latin American Coalition. We also provide support around credit recovery. It is a very good strategy that we use there. And then around master scheduling training, we also do home visits. And so when we look at that number, those are some of the strategies that we've employed to help increase that number. And I would say that we could and we should actually systematize those things so that we're not just doing those with certain subgroups of students, but that we're doing that district-wide to see the impact that we want to see.
Thank you.
So it's really interesting to hear about, the reality of our students, English learner students who come to us from other countries often with very different, like you said, having already finished school in their home country or coming here with an expectation that they're going to go to work pretty soon, full-time, to support family. I'm just wondering if, we're not alone, this is happening across the state, not just in CMS. I mean, I know we have a higher concentration, higher international population perhaps in Mecklenburg County than across the state, but this is happening across the state. So I just wonder if there is something that we can do locally, and also something, this is a big future-looking question, but even statewide, talk to the state board about what are you doing to retool education to match, to give a meaningful and relevant experience to students who are coming with a very different set of needs than we were seeing 20 years ago or 30 years ago. I don't know the answer to that, but.
Well, I think part of the answer, and it's just part of the answer, is that we have to continue to collaborate with our partners in other school districts. We do have, job level alike positions throughout the district. So I meet with peers at the superintendent level. We have chief academic officer and so on who meet with their peers. And then we also have a national network as well, which I know that you are a part of with other board chairs across the country. And so we have to continue to utilize that network to find new and creative ideas. And I would say that it's not so much that we have to go out and do a whole lot of new things, but we need to deepen and work with more of a sense of urgency around some of the things that we have in place and make those system-wide versus just having them at certain schools, because some schools have fared very well in terms of their results. And so we need to systematize some of those things. Not that we can't bring in new ideas. That is not what I'm saying. But I don't know that it takes a whole lot of new ideas, but maybe just pressing harder on some of the things that we are doing right now.
Okay, thank you. I see you thinking, Ms. De La Hara.
Yeah, I am. My wheels are spinning here.
Thank you.
So I didn't come with this question prepared, but I'm going to try to do it in the format that we need to. The original question stemmed around the dropout rates for Hispanic students, and that quickly devolved into a conversation around English learners. And I want to be very clear that not all Hispanic students are English language learners, nor are all English language learners Hispanic.
And when I asked my question, I was.
Not you, I was.
Okay, I was referring to the English learner
I was going back to
category.
Carol's original question and then the superintendent's response, not to yours, yeah,
Okay.
no. So I was still spinning through that while you were talking, actually. So, but I'm just thinking out loud, like, would it be beneficial to have this data in the future broken down so that we could understand that differently? Because these are two very different cohorts when we're looking at Hispanic as an ethnicity, specifically some being English language learners in a secondary setting, some never having been an English language learner, English being their only language, some maybe starting and testing out in elementary. But I don't know if that's a possibility. Would that be helpful data to the district to break that down more specifically within that subset?
We can certainly do that. Ms. De La Hara. I know that we have access to that data. I know that this focuses on the current strategic plan, and I know we're transitioning to the new goals and guardrails that the board approved. But we can certainly, if this were to come back for a future progress monitoring report, or just separately, if the board wanted to see that information, we could make that available.
Okay, I think that might be helpful for all of us. Thank you.
Ms. Shipp?
I think this was alluded to on page 4 or 5. But as we talk about how we can support all of this, my question is, how are we looking at transitional years that leads to 9th through 12th grade? That transition from 8th grade to 9th grade, I think is very important. So I'm asking, going future forward, how are we doing better with transition years that really supports, as we begin to look at dropout rates, attendance, what does that look like in transition years?
Yes. So that transition year is, as a former, well, once an educator, always an educator. So as an educator, Ms. Shipp, that is definitely an area that we want to focus on. And we do have a bridge program, a summer bridge program, where we do focus on helping students to make that transition successfully from 8th grade to 9th grade. And we actually have 6 schools this summer that will be participating. There will be sites for our summer bridge program. We also have opportunities to extend learning for students beyond the school day, so during the morning or in the afternoons, and also during the summer using our extended day funds. So that's another area that we could help. We do currently help students with that transition from middle school to high school.
Because I think all of that, yeah, starts early.
Mr. Strain?
Thank you, Madam Chair. And thank you for this report, Mr. Superintendent. One of the things that we have discussed in the past is the integrity of the diplomas, right? We've started focusing a lot on certifications, et cetera, right? And certificates. And so how do we ensure that we preserve and potentially renew the integrity of the diploma from that perspective, and how is that related to the data in this report in terms of our graduation rate?
So I think in terms of the integrity of the diploma, which is something that we are always wanting to be cognizant of, and so that it's not just a piece of paper that we're handing students, but that it actually means something, and that students can go out and do something with it, whatever with it means for students, whether it's college, career, military. It looks different from every student. And I know that graduation rate is not specifically called out in the board's new goals and guardrails, but I do think that when we talk about having students graduate with a NCDPI endorsement or having successfully taken an advanced course, I think of it in terms of the diploma being the floor, and really the board has indicated through its goals and guardrails and said, you know what, that's not enough. We've got to have students who are graduating and that diploma means something. And so I believe through the new goals and guardrails, you all have indicated that just a diploma by itself is not enough.
No, I appreciate that, and you called out the endorsements, which are a key strategy in and of themselves. So regardless of the change of business rules that we've talked about a little bit, our graduation rate is clearly in decline, right? And so it's headed the wrong direction. Not only are we not doing well enough, it's actually in decline, or has been on this chart here. So of the strategies that you've laid out, which is the most promising to unlock students' potential, and what do you need from us to be successful with that strategy?
Yes, so let me start with the latter question first. And that, what do we need as a team from board members? And I think you will see this in upcoming budget requests, is that we do need additional support for our students. In the form of counselors, in the form of social workers, in the form of psychologists. Another area that has proven to be very effective at some high schools that employ a graduation coach, that's another area. When I talk about making sure that we systematize pockets where things are going well in some high schools, we want to broaden that scope and make sure that students elsewhere have access to those same graduation coaches to help keep them on track, or when they are off track, to get them back on track to ensure that they can successfully graduate with their cohort, which is what this report is about.
Yeah, I can imagine, certainly on the counselors and even the social emotional, those supports being in place for students certainly helps them, guides them, in addition to their teachers, the leaders in the school, et cetera. And so certainly appreciate that. I think one final reflection for me is we've talked a little bit about some of the social promotion that takes place. And, that's obviously promotion without having met the requisite both mastery and performance required generally to promote. And this is happening up through the grades. And we looked at some of these cases last year. How is that reflected in and contributing to the graduation rate?
Well, so what I would say, Mr. Strain, about that, I can't tease that out in particular and give you a particular data point, but we know that we do students no favors if we don't provide them with a meaningful diploma and meaningful, rigorous coursework. And so to the extent that we have not met our own expectations around that and providing students with what they need to be successful later on, not just with us in Charlotte-Mecklenburg schools, but we want to produce students, citizens, who can be contributors to their communities and our world. And so to the extent that we're not doing that by providing them with a quality, rigorous education, then we've got work to do. We've got work to do.
I appreciate that. I think it's probably worth revisiting some of those strategies and how they are impacting things like graduation rate. But we'll certainly have opportunities to talk about that as we go into our goals and guardrails in the future as well. Thank you.
I have a question about engagement. On page 3 of the report, you point to a correlation between students who are off track for graduating with their cohorts in 4 years with also being disengaged. And we can measure that disengagement through the Panorama survey. And so I guess my question is, what are some strategies to increase that student engagement? What are we going to do about that? And a corollary is, have we included asking students to be sort of strategic partners in advising that? A two-part question.
So the second part, have we incorporated student voice as part of that process? We do, but there's certainly room for growth, and we can certainly do more of that. So for example, every opportunity that we have, and one opportunity I will have tomorrow evening when I meet with our students, our high school students, is to ask them, how can we better support their education so that we're removing barriers along the way and providing them with a high-quality education. So, yes, we could do better at that. We do some of it, but obviously, we're not where we want to be.
But specifically, are we at a place where we can look at, okay, we know kids who are disengaged are also kids who are not on track to graduate on time. So what can we do specifically to help them re-engage? And perhaps, I don't know if it's correlation or causation, but perhaps that will lead to them graduating on time.
Well, so we have to make sure that we're being thorough in our progress monitoring and that we are intervening early on and not waiting until senior year. If we can get them to their senior year, the overwhelming majority of our students do graduate. And so making sure that we engage students early on, and that can be through a number of means, through graduation coaches, having a trusted adult, making sure that we have counselors, enough counselors and students are utilizing those services. But we definitely, when we intervene, we have to provide students with real-time supports. And that support could look different from student to student. It could be a mentor, it could be a tutor, it could be additional instructional support before and after school. It could be through credit recovery. And I know the board recalls that we refined and strengthened our credit recovery process a few years ago. So those are some of the ways that we can help keep students engaged. And we also have to make sure students are taking the right courses and on track for graduation.
I see Juan might have something to say about this.
I just started thinking about something. So usually the board and CMS think a lot about students and their well-being, but many times parents and students and people who are not constantly watching meetings are not able to know the things that the board and CMS does for them. So my main question is, what is CMS or the board's plan to communicate this information to students more in a thorough way that they're going to be like engaged to know more about this plan and like actually be excited to keep going to school and like helping the board and CMS and like achieve this goal, because CMS can give a lot and they can provide students with the tools, but how are we going to make sure that students also want to use those tools?
Sure. So I think that's a great question, and I think a primary communication tool that students utilize are their counselors, are their administrators, are their teachers. And so making sure that you all have the information that you need to get the supports that are necessary. We also need to do a better job with communicating with families and making sure that families understand all of the opportunities that exist and what are we doing to help students be successful and remove roadblocks. And then, quite frankly, it can't just be us saying that here are the things that we're going to provide you. We have to ask you, what do you need? What do you need? Because that looks different from student to student, and it can't be a one-size-fits-all approach. So that, I would say that's the third thing. We need to make sure that we communicate and ask students, what is it that you need? And it's not us telling you, this is what.
And how is it that CMS wants to get that information from students? How do we want to get that feedback from them?
I think we can certainly do it during school time. We can do it via surveys. We can also do it during opportunities where staff meets with students outside of the school day. For example, as I mentioned earlier, an opportunity that I'll have tomorrow to meet with Generation Nation. So those are some of the ways that we can do it. We can also utilize tools that you all use so often, and that's through social media. I know we've talked about using that platform to help inform our students and get feedback from our students. And so that's another platform that we can use.
Thank you.
Any more questions? All right. All right, well, you guys, you want to just run through the evaluation piece really quick? No? Rhonda doesn't.
I want to get on to the business.
I know. So real quick, preparation. Just take a minute and figure out where you think the board is on that. And you should have copies of the progress monitor. Chair. Let me know when you're ready.
Under preparation.
Yeah, preparation.
Approaching.
Where do you, what?
Approaching. There.
Approaching? Approaching. Okay. Is that where everybody is? Okay. Yep, I guess it was some. All righty. Well, that's moving up from last time. Okay, data and opinions.
Say, at least effective, maybe more.
Yep,
Almost no one mentioned.
Yeah,
go
Effective?
effective.
effective,
Yeah, effective.
effective.
Okay, cool. Q and A.
See, we're in the highly effective,
Say that again?
somewhere between effective and highly effective.
Let's go
I'm
with
between
effective, so we have room
effective
to grow.
and between the two, but I probably effective.
They were open-ended, for sure.
Yeah,
Should we say effective?
Yep.
Yes.
yeah, effective.
Okay, past and future. I did not keep track of when we switched, but,
I think we're really approaching on that one.
okay.
Because it was both, for sure.
Yeah, it was both, approaching.
Progress monitoring and project management.
Approaching, or I don't think it's any more than that.
I mean, that would put us under effective.
Yeah, I think we're between approach and effective. I think we really were moving towards effective.
Okay. Let's go
Yeah, I mean, we
effective.
didn't get into discussing operations and things like we've done in the
Yeah,
past.
and
so that was
programs, and
Yeah, that's something I think.
we kept it pretty
Yeah,
strategic
I
and
think
tied
we
to the
got-
report.
I think we got
Okay, so
effective.
approaching?
Approaching.
All right,
Approaching, okay.
well, good. Well, that is that. Thank you, everybody. So now, we will move on to what everybody in the room wants to hear about tonight, which is policy CFC, universal face coverings. I'm going to turn to the superintendent for this report, but first, just a quick reminder, thank you, everybody, for being so patient thus far, and continuing with that. You know, let's just, I know the passion is there, but let's keep the applause down, let's keep the jeering down, because we've got really important work to do here, and we need to make sure that everybody can hear us do our work. And so with that, I'm going to turn to the superintendent to introduce this report.
Thank you very much, Madam Chair. And at this time, I would like to recognize Laura Francisco, our Associate Superintendent of Human Resources. And Ms. Francisco will provide an update on some of our partnerships, some updates to the North Carolina Department of Health and Human Services Strong Schools Toolkit, as well as take an opportunity to remind our families, our students, as well as our staff about some mitigation strategies that we have in place in Charlotte-Mecklenburg schools. And then I will pick back up after Ms. Francisco. I will turn it over to you.
Thank you. Good evening, Madam Chair, Superintendent Winston, members of the board. I'm just waiting for my slides to come up here. I am going to give you an update this evening on our continuing COVID response efforts. Just a brief overview of what we continue to do, and then, as the superintendent mentioned, some information about changes to the toolkit, and that's a different PowerPoint. There we go. So there are many response efforts that are ongoing. The next slide, please. Oh, I have the remote, sorry. There we go. We know through our vaccine attestation process that a very high percentage of our employees are vaccinated, about 88% of those who have responded. We also continue our state supporting testing program that's available for students and staff. The rapid antigen testing is available for all of our staff who may feel symptomatic or feel that they have been had an exposure. The PCR tests are available for students and staff who have consented into the program, and those are available in all of our schools every day. We have a strong partnership with Mecklenburg County Public Health. We have school-based COVID response support staff that are placed in each of our schools there to support kind of all things COVID, testing, isolation room support, notification letters, whatever the school needs for them to support the COVID efforts. We also have community testing in several school parking lots, and we have individual schools that are choosing to have vaccine clinics on site, again, just to continue building awareness and support for vaccinations. We also have about 35 nurse extenders in our schools, also supporting COVID response. Our PPE supply is very well stocked at our warehouse and at our schools. We do have the same items that we've had available since the beginning of the pandemic. In addition, now we've added the KN95 masks for our staff. And there's a whole process where each school has a PPE coordinator, and that person connects to the warehouse through Lawson and orders what they need for their school, and it's delivered through our warehouse delivery. We've also made indoor air quality solutions and adjustments, kind of a tiered approach. We have our MERV 10 filters and duct cleaning, upfits to some of our exhaust systems, and then the installation at the 38 schools that did not have outside air of the needlepoint bipolar ionization. In terms of the toolkit, effective yesterday, there is no more contact tracing, so that's been eliminated, and quarantine of students and staff who have been exposed has also changed. We have individuals who are exposed to the virus monitoring for symptoms, make sure to get tested and wear a mask for 10 days. And then we will notify families and staff of potential exposures at the school level once weekly as those cases occur, and if they don't, then we won't notify, via the CMS dashboard, as well as information directly from the school. And then at a more granular level for our athletic teams and extracurriculars that have a very defined roster, we will notify those groups if there has been an exposure. So with that, I will turn it over to Superintendent Winston for his recommendation.
Thank you, Ms. Francisco. During almost 2 years of facing the impact of COVID in our schools and in our community, we have learned a lot about this virus. The consensus now is that we have entered a period when COVID is going to be endemic rather than pandemic. To put it in simple terms, we are going to have to live with COVID. Fortunately, we now have more tools in our arsenal to protect ourselves and others than when we first encountered the virus. Vaccines are widely available, and we continue to recommend that all who are eligible stay up to date on vaccines. Get vaccinated, and when eligible, get your booster. Medical quality masks, like the ones Ms. Francisco talked about a few moments ago, our KN95 mask, that we know that they are effective in reducing transmission, and we have those masks available for our staff. Proper hand hygiene, frequent washing of hands or using sanitizer. We know all of those help prevent spread. Social distancing, when possible, is recommended. Our air optimization effort has been completed at the schools and facilities most in need. And this effort continues throughout the district. And we know that there is an agenda item today that deals with some of that future work. We also have enhanced cleaning procedures that continue throughout our facilities. And so I just want to recap the guidance. The Strong Schools Toolkit has been updated by the North Carolina Department of Health and Human Services. This no longer requires schools to manage contact tracing or mandate quarantines. Dr. Raynard Washington, our director of our public health department, recommended ending its mask mandate effective February the 26th, and the Board of County Commissioners voted to take that action. In addition, Governor Cooper announced guidance that goes into effect March 7th that recommends that all schools move to mask optional policy. And so with this information in mind, I have spoken or heard from principals, staff, and students about our mask policy. And The opinion is best described as mixed about the most appropriate action and the most appropriate effective date for a change to mask optional. And so my recommendation is based on several factors. We know that the cases in our area continue to drop. And Dr. Washington, who will come before you shortly, has stated that he believes that our community will be out of the high substantial spread category by March 4th. We also know that the CDC and Strong Schools Toolkit recommends that masks be worn indoor public settings in areas of high or substantial transmission. I will also add that many of our principals have asked for some runway to implement a change in policy of mask optional on the heels of other recent changes, including eliminating contact tracing and quarantines. And then we also mentioned a few moments ago Governor Cooper's guidance that goes into effect March 7th. And so I bring forward a recommendation that CMS move to a mask optional policy for all CMS facilities effective March 7th. This applies indoors, but do not change federal regulations that covers buses and forms of transportation in CMS. Masks will still be required in compliance with these federal rules on our buses. And I just want to emphasize that mask optional, it means just that. Individual students, staff, and visitors to our campuses may make their choice of whether or not to wear a mask when indoors. Families make that decision for their students. This does not mean no mask. Based on a consensus of infectious disease experts, it remains the recommendation that individuals wear masks when indoors. And I do want to end on this note. There will be no tolerance for bullying or intimidation of those who choose to continue wearing masks. Such behavior will be treated as any other form of bullying as defined in our Code of Student Conduct Handbook. And so now I want to introduce Dr. Raynard Washington, who is here to provide expert information about COVID-19 in our community. He is our public health director, and Dr. Washington's expertise in infectious disease has helped inform the recommendation that I shared a few moments ago. And after his remarks, and again, thank you, Dr. Washington, for being here. I know it's been a long day for you. But following his remarks, Dr. Washington will remain to answer questions that board members may have.
Wonderful. Well, good evening, everybody. To Superintendent Winston, as well as Chairperson Dashu, and all of the Board of Education members. It's wonderful to be here with you all this evening. This is my first time seeing you all in person, so it's very good to see you all and very good to be here. And I look forward to future engagements throughout my tenure as health director here on other issues outside of COVID. And thank you to all who are here this evening to express your feedback relative to this issue. Let me start by thanking the superintendent and his staff, Laura, and the entire team who've been working on the district response team. You all have been incredibly great partners for us at the health department throughout the last 2 years, and it has been incredibly challenging. As I think everybody in this room knows, our understanding of the virus, as well as our understanding of what tools are most effective, as well as the availability of those tools, has evolved over time. So I want to thank them because they've stuck with us. They've dealt with the confusing guidance. They've worked with us as we've had to shift and pivot at many intervals, and so I really appreciate that partnership. I don't have a presentation this evening, but I will provide a couple of additional comments as well, and look forward to answering whatever questions you all may have for me that I might be able to help in your decision making. But I also would like to acknowledge the school-based coordinators. I'm going to take a moment of personal privilege. There are about 180 staff people who we were able to bring on board in the last 6 months.
I'm sorry, I'm going to interrupt you for just 1 second, Dr. Washington. If you could lift up the sign, you've kind of, no, the gentleman behind you has the sign in your space. If you could just lift it up behind that barrier.
didn't
Thank
even
you, I
see it.
appreciate it.
It's okay.
Hey, go right ahead. I'm sorry, go right ahead. Mr.
Sure.
No, just don't play the games with the camera, please.
It's, just let them do
Okay.
what they want to do.
Go
It's
right
not a
ahead,
big
Dr.
deal.
Washington.
So certainly, I think I was saying something. 180 school-based coordinators who are folks who have not, who have come on board in the last 6 months and are in every school and will continue to be in those schools throughout the school year, and we are committed to that. And they will be there to continue to help our administrators, staff, and families navigate their way through COVID. I won't rehash my comments from last week, but I will say this evening that we are at a pivotal point in our response to COVID. I've said multiple times over the course of my tenure as health director, which is about week 6.5, that we have to prepare ourselves, as the superintendent has already mentioned, for what the future looks like, what life looks like with COVID in our community, because we are not on a pathway to global eradication. And the reality is that we'll continue to see COVID circulate. I do expect that we will have surges in the future, much like the Omicron surge, or maybe different. I'm not certain because I don't know what the virus is going to do, so I don't have a crystal ball. But I am confident that our conditions today are so markedly improved from where they were several months ago, several weeks ago even. Our hospitalizations have declined fairly significantly. We are continuing to see those declines, which is very encouraging. All of our key metrics that we track have declined significantly, and the conditions on the ground are better. Our testing is widely available. We do have high-quality masks available for those in our communities. We have a whole outreach operation that's working to make sure people have all the tools they need to be able to protect themselves, as well as their family. And so those conditions are encouraging for us in public health, and I do think that this is a great opportunity for us to transition to what I've called COVID Response 2.0. I won't talk about all the aspects of that plan, but I will talk about this issue of masking. Last week, I made a recommendation to the Board of County Commissioners that has already been mentioned this evening to rescind the countywide mask mandate as a result of those improved conditions in our community. I also made a similar recommendation to this board, as well as all of our education partners in the community, so not just the public school system, but also our university partners, as well as our private and colloquial schools relative to their mask mandates in place, to prepare an off-ramp that I believe now is the time for that. And I do believe that there are some very important considerations for the schools as it relates to how this is implemented. One of the important things that's already been mentioned this evening is that we just stopped doing contact tracing, and we also stopped the quarantining of students who are not symptomatic. All of these processes require management at the school level. They do require people to follow, to track, to make sure. When we transition to a mask optional environment, it is also important to implement new procedures relative to what that looks like in every school. And part of the reason is, if folks remember, probably about a month and a half ago, the CDC changed their isolation guidance in terms of how long people needed to be isolated. And shorten that time period to 5 days. And what that means is that individuals are free, if they don't have any symptoms, to be released from isolation early, but with the requirement that they continue to wear a mask, a close-fitting mask, when they're still in public settings, particularly public indoor settings. We are working very rapidly to make sure that we can appropriately advise, train our staff that are in the schools, as well as make sure that the school-based team has all the resources necessary to prepare for that transition when we do go to mask optional, assuming that this board makes that decision, to make sure that that's in place. And we do need to make sure that's in place, because what happens is a child or a student or a staff member will come back to school at day 6 with no symptoms, but they are still infectious. And so we do need to have some protocols in place to make sure that those individuals do in fact adhere to the mask wearing in the school, because they really should be required to do so, which is very different now now because, again, we're not adhering to the 10-day isolation period. People can be released from isolation early. So we do need to work on those protocols over the course of the next week or so to make sure that schools are prepared to do that. And I recognize that that's something that we at the health department in partnership with your team will need to be doing to make sure that works effectively. So with that, I am supportive of you guys' recommendation on the table from the superintendent and look forward to any questions you might have for me.
All right, thank you. And before we go to questions, I just want to welcome you officially. We are so fortunate to have such a strong working relationship between CMS and the county health department. I know not all school districts and county health departments have that healthy of a relationship. So really grateful. I don't know how we would have survived the last couple of years without you all, and I'm just so excited to be working with you in this capacity. So thank you so much for making yourself available to answer our questions during this critical time, and I'm going to turn to Ms. De La Hara.
Okay, thank you, Madam Chair. Thank you, Dr. Washington, for being here today with us. I greatly appreciate your report, and I watched you last Wednesday as well. I'm sorry, my computer's deciding to die out on me here where I have my question. As you, I'm sure, recall, I wrote you last Monday anticipating your presentation before the County Commission and inquired specifically about the CDC guidance that still states that universal mask coverings are recommended for schools. And I did that specifically. I asked you to be clear, and I thought you were clear. So thank you, sir, for being so clear that night. But because many people maybe didn't hear that are watching on the TV or Facebook or whatever tonight, your distinction around that, I would just like to ask you to maybe repeat some of that information around how you're interpreting that as it relates to high transmission, because that is certainly a concern for many of our families who've also written us and teachers and educators alike.
Certainly. So one thing I was going to close with, but I'll say now is the mask optional or mask requirements are simply the policy. The reality is I continue to recommend for individuals to wear masks in public indoor settings, particularly if you are at risk for infection, and even more so if you're at risk for severe infection or some severe consequence of having a COVID infection. That includes people who are not yet vaccinated. That includes people who may have some underlying health condition or maybe otherwise immunocompromised or vulnerable medically. I do continue to make very strong recommendations that those folks wear masks indoors. And for those who are able to manage with masks and want to protect themselves and are at risk of infection, I also encourage it for them. The CDC has established a sort of a grading system, I'll use that expression since I'm with the Board of Education this evening, for how to determine or classify when communities are in certain levels of transmission relative to what the viral activity is in a community. There are two metrics that go into that definition. The first of those metrics is case count, so the 7-day case rate per 1,000 people, which is basically the number of cases that we count over the number of people in Mecklenburg County. There are 4 tiers for that metric, and there are also 4 tiers for another metric known as percent positivity. Percent positivity is the proportion of tests that come back positive of all the tests that are done, of all the molecular PCR tests that are done in clinical settings in the community. Those two metrics have sort of the 4-tier grading system, and whichever one is highest is the classification where your community lies. The CDC developed this as a way for communities, counties, and states to understand and have a uniform way of measuring activity in the community. Both of those indicators are becoming increasingly less reliable. They are still reliable, they're informative, and they're important. But because of the, again, changing conditions in our community relative to the availability of rapid at-home tests, as well as the reality that many people who are infected with COVID may have very mild symptoms and some may be asymptomatic altogether. And so there are a lot of, we as a public health agency, both locally at the state level and the federal level, are doing a poorer job of being able to count all the cases that are in the community. And so with that being the case, I do anticipate as we are, again, and also there's this reality that COVID's going to be here. And so how we do surveillance and how we make decisions about what community mitigation measures we impose or put in place really should be driven by impact. What's happening in the community, What's the status of our healthcare systems? What's the status of our emergency medical services? What's the status of our schools in those areas in the county where there are critical supports and services? Really should decide at what point we take the most extreme measures in terms of mitigation. So with that, I do anticipate that our partners in the federal government, at some period of time, I don't know when that will be, will begin to make this transition with us as well. I know, are working on plans relative to how community transmission is tied to recommendations around universal masking. I've not been privy to any of those discussions at this point, but I do suspect, just based on my own professional opinion and expertise, that guidance is going to be driven by more related to severe impact in a community as opposed to counting cases.
So with the unreliability of the percent positivity, and I'm glad we're here at a place where we're coming to an off-ramp, but how will we have information, guidance, metrics for a potential on-ramp? Because you just mentioned the situation in the community, hospitalization rates, many things to understand impact. Like, I guess that might be a question for you, sir. Like, do we have, if there were a surge, now that we're coming to this off-ramp, what then is the on-ramp to understand that we might need to go back since we don't have the reliable data?
Sure. So let me just reemphasize, I'm not saying those metrics are not at all reliable. I'm just saying that they're less reliable particularly as early indicators. And so we have been working to, and again, I am so impressed with our science community and the work that they've done to be able to really move our response efforts forward in a more sustainable fashion. But there are a couple of other early indicators that we are going to rely on to help us understand what's happening. We continue to monitor emergency department activity. That's one of the very early indicators that something's happening. We also continue to monitor what's happening with our hospital capacity overall. Just, are there beds in hospitals, not from COVID, but from anything else as well. We also have a new, relatively, I guess I'll say new approach that we've applied to COVID is that wastewater surveillance. We currently are able to, not anybody's house or individual, it's no way to decipher from one person to the next, but at the wastewater treatment facility where all of the wastewater comes in, we are able to sample from that and be able to detect volumes of viral particles in the wastewater products. We have been watching that very closely and how that relates to case rates throughout the Omicron surge, which has been very helpful for us to create a baseline to say, okay, does this work, number one, and what's the relationship between those levels of viral particle and the relationship of activity in terms of case counts in the community. And so we will be using that as well and are working with our partners. And I must give a shout out to our partners at UNC Charlotte and the folks at the state because they've been working to really help us move this along and make it really a reality for us. And so we're working to even further expand that so that we can have, and even in particular high-risk settings like our shelters and prisons, is there a way we can implement that work to even have implementation there? So I think in terms of the on-ramp, the last thing I'll say is we do have a sequencing project here in Mecklenburg County. We're one of the very few counties, and maybe the only, that's investing our own resources and actually doing sequencing of cases, positive cases on a weekly basis. That allows us to be able to understand when there are emergent variants. And again, we have some geniuses in our own community who are experts and able to look at and understand genetic sequencing much better than I do personally. But are able to help us monitor for emergent variants. And of course, there's a whole network of folks across this globe who are monitoring for variants to help trigger when something might happen. And so again, I said this last week at the Board of County Commissioners meeting. I don't know what the future holds. I don't have a crystal ball. But I certainly want to be sure that we are doing everything possible to make sure that COVID's impact is as minimal in our community, but that people in our community have an opportunity to have experienced some sense of normalcy relative to the experience we've had the last 2 years.
One last quick question, and I'll let others jump in, and I'm sure we'll go around. But what is the current vaccination rate, I guess, for adults in Mecklenburg County? I know we just heard that it's 88% among our educators, which I think is pretty great. Can you talk to us more about Mecklenburg County's plan to continue to increase vaccination rates? Because we keep hearing that is the best line of defense, and I agree. And how can we partner with you or continue? I heard Ms. Francisco, I was thinking Miss Laura, Miss Francisco, thank you, talk about that. But how can we continue to partner to make sure that we're offering every opportunity for our residents to be vaccinated?
Sure. So on the kids up front, you're putting me on the spot. I don't have any, actually, don't have notes. So, but I know among the 5 to 11-year-olds, I believe we're close to a third of those individuals, young kids, receiving their first dose. And for the 12 to 17-year-olds, it's closer to 60% of those have received their first dose. And then in the community overall, we're roughly at 67% of all of our population receiving their first dose, and approximately 62% that have received both doses. Our booster uptake is roughly around 30%, and we're working closely to get that number up, particularly for our vulnerable older adults and folks who are medically fragile. Our team is working right now on sort of reimagining our vaccine outreach. For the last year, we have worked every possible angle that we possibly can imagine to make sure people have access to vaccines and the information needed to be able to make a personal decision about their health and receive the vaccine and answer questions. There's so much misinformation and disinformation that we are working against. And so we've been doing that full steam ahead, and we're reimagining that now. Are there other things that we can be doing? And I lean into you guys, to the folks in this room, to the parents, the children. If there are other things that we should be doing or can do to better understand, better make information available to people, we are all ears to those ideas and would love to hear more from folks as people have thoughts and ideas.
Thank you, Dr. Washington.
Okay, Ms. Cheek, then Ms. Shipp, and then Juan, and then Ms. Marshall, and then Ms. Sawyer.
Thank you, Dr. Washington. It's amazing to have you here. I'm not sure if you know, but 2 weeks ago, I said that we needed to have you here, and I said that we needed to be discussing this as a board because we weren't doing that. So I'm extremely glad that you're here. I'm extremely glad that we as a board are discussing this. I thank Ms. De La Hara for bringing up the changing metrics. This board met on March 13th. It was a Friday the 13th, 2020. When COVID was just making its appearance in our state. And there was a lot of comments made that night. It was a very emotional night. People even accused us of having people's blood on their hands if we didn't move quickly enough to shut down our schools at that moment. We didn't know then what we know now. We didn't know last August what we know now. We certainly didn't know August of 2020 when we, as a board, made the wrong decision and kept kids in remote learning. We didn't know what we know now. So now that we know what we know now, we need to do better. We need to do better with our kids. We need to do better for our staff and for our community. While I'm not an anti-masker, I am a mask optional person, so I'm very happy with your recommendation. What I would ask you is, I know that some of the key metrics right now are the wastewater, and I'm really fascinated because UNCC's been publishing their data. And it was quite interesting when the students weren't there, what happened with their numbers, and you could kind of tell when the students came back, there might have been a little bit of COVID that nobody was getting tested for based on some of their wastewater. I have a college student, so I can say that. I'm sure if they tested Chapel Hill, they would find very similar data. So we're looking at hospitalization.